Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Cluster feeding, reasons and tips for managing it. What is cluster feeding? Cluster feeding, also known as bunch feeding, is when babies frequently feed at certain times of the day and go for long periods between each feed at other times. It is common among newborn babies and often occurs in the evenings. Cluster feeding is totally natural in most babies up to 6 months of age. When can you expect cluster feeding? Cluster feeding generally takes place shortly after birth. These closely timed feeds stimulate the breasts to produce more milk to satisfy the baby's growing appetite and need for nourishment. This can be expected around 10 to 12 days, again by 3 months, and so on. Cluster feeding doesn't last forever and usually ends when the baby reaches 6 months of age. Is it natural? Cluster feeding is entirely normal, and most babies go through that phase in the early months. Does it mean that your baby needs more milk than you can supply? It is important to remember that cluster feeding does not reflect a low milk supply. It is a natural process by which the cluster feeding newborn prompts an increase in the milk supply by your breasts and should be allowed to happen. When does cluster feeding end? Cluster feeding often occurs in a bunch. A typical cluster feeding phase can last up to 48 hours and sometimes less. How to cope with cluster feeding? 1. Eat well and stay hydrated. Your body needs plenty of fuel to keep up with your baby's milk demands. So make small, regular meals a priority and drink lots of water. 2. Take a nap when you can. Feeding your baby for hours on end, especially at night, is exhausting, and skipping sleep can only make it worse. So, it is better to get sleep whenever you can. 3. Join a support group. Talking to other moms about your feelings and frustrations can help your feelings of loneliness. Discussing helpful tips and techniques is valuable to support during fussy feedings. 4. Wear your baby. You can wear your baby if cluster feeding is making him difficult to stay away from. Buy a sling or a baby carrier so you can wear him around the house. 5. Get comfortable. When you have a cluster feeding newborn, you will often be stuck in a place for a while. So keep things like magazines, remotes, or phones at arm's length. 6. Get some help. Any willing volunteer who can spend time with you by having entertaining conversations, getting you snacks or drinks, or helping with housework and errands can be a blessing. When to consult a doctor? If the baby feeds for more than an hour at a time or if the cluster feed lasts for more than 2 days, consult the doctor. Although it can be exhausting, cluster feeding is completely normal and temporary. You can enjoy the long hours of snuggling with your baby while the phase lasts.